Alright, so I'm going to demonstrate some scapular mobilization techniques here. You can do it from the posterior side of the patient or the anterior side of the patient. It really just depends on your preference and how you want to grip that scapula. I'm going to show it from the back side so that way you guys can kind of see it a little bit better. So I like to kind of get the patient's arm in like a rested position, whether it's up on their hip depending on how much range of motion they have, or kind of down by their side. Sometimes they can't get there, so you just leave it straight in front of them. So you're going to hook your arm underneath theirs. You're going to get right on that inferior angle of the scapula, so you can kind of just feel around. It's usually pretty easy to find. And you want to get, I like to use my lesser three fingers to kind of get right on that vertebral border, and then my thumb to get right on that lateral border. And from here, you can kind of just scour through that range of motion and feel for some restriction. You probably would have assessed how their scapulohumeral rhythm has looked at this point, and you can, if they're not getting enough upward rotation, you can work on providing some upward rotation. They can even get a little bit of active flexion into this direction here, so you can help them get that upward rotation. Or if you're trying to prevent early upward rotation, you're going to want to work on some depression and retraction of that scapula, and you can kind of just bring them down and back. You can do some scapular manipulations, give them a little quick thrust in that area as well. And you can just give them a break, move them up, move them back. You can even get a little bit of a stretch if you want to stretch some of these tight scapular retractors. You can hook your fingers underneath that inferior angle and kind of get into a winging position. And you can get a little bit of a lift here and stretch out some of those rhomboids and mid-trap.